We are continuing our discussion on the coronavirus or COVID-19 pandemic, with new case numbers still high but starting to level off slightly throughout the country and here in Orange County. Many residents are questioning what we should do next. Orange County government is still suggesting that all residents wear face masks while indoors, and many companies are issuing vaccine mandates to their employees. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. We caught up with Orange County Mayor Jerry Demings recently to give us an update on our fight against COVID-19.
We are doing fantastic. I can tell you that for the first time in a couple of months now, our overall positivity rate for COVID-19 is below double digits. It is 8% or below. In fact, for the last few days, we have seen positivity rates on a daily basis as low as a little over 5%. So our goal is to get to the point in our community where we have a sustained positivity rate for 5% or less within our community. When we get to that point, essentially what the CDC says is that we have contained the virus. And so we're working hard to get to that point, to get up the rate of vaccinations within our community. We want to run through the finish line. That means that we still want individuals who have not been vaccinated to get vaccinated, and those who are now eligible to get their booster shots, we want them to get the booster shots, because when we do this as a community, that results in immunity.
Thank you, Mayor Demings, for that update, and we'll be right back. Stay with us. Let's get an update from our state medical professionals, and joining us is Dr. Thomas Prince, Medical Director with the Florida Department of Health in Orange County. Dr. Prince, thank you for being with us today.
It's a pleasure to be here. Thank you, Clarence.
So, Dr. Prince, tell us where we are in the state and Orange County in really getting a handle on the pandemic.
Well, that's an interesting question. I mean, I think that you can answer that in many different ways. The truth is, this thing has been going on for we're coming up on 2 years now. I mean, December of 2019 was the first cases were reported there in Wuhan, China. So as everybody's aware, we've gone through many different waves here, and now the variants have come along. So the question is, if we're going to talk about where we are, we've got to know where we're going, and where we're going is unclear. It's my belief that this thing is going to continue to burn around the world for a while, and we're going to be dealing with variants for quite some time. Maybe as I was reading an article in the Wall Street Journal today, which by an infectious disease specialist, who suggested that it would soon be an endemic disease. It would be a disease we're all just basically dealing with, just like malaria is in some countries. You're just constantly dealing with it, and I suspect that will be true of COVID. So I think we're on our way, and there's no question in my mind that the vaccinations are going to be helpful. But and I think we're going to be fortunate here living in the United States, but because I mean, a lot of the countries are unable to vaccinate at all. The only way they're going to get it immunity is through passing through everybody for the large part. So I think what we'll see is slowly diminution in the amount of distress it causes, but I think we're going to continue to see this for quite some time.
And keeping that in mind, are we starting to see case numbers go down here in Florida?
Yes, we have been seeing as you know, we've had wave after wave come in, and our most recent wave, which started in August, was peaking end of August. That wave is come down quite a bit, and I can't give you the exact numbers on that, but I can tell you, we've come down quite a bit from our high of about 25, 30 days ago.
So in the news, we have already heard that booster shots of the Pfizer vaccine have already been approved. Why do we need a booster?
Well, booster, the term really refers to boosting the immunity. And what we're talking about here is when we get a vaccine, when we get these vaccines, we produce a couple different things get in production. Antibodies, which are molecules that our body produces, which attack the virus and are able to keep the virus from overwhelming our body. It also immunity, we get immunity through T cells and B cells, which are specialized white blood cells that function in our immune system specifically to fight these types of things. What happens with our immune response is that when we get exposed to something like the COVID virus or like the common cold or the flu virus or smallpox for that matter, any of these things, we create a system in which to destroy the organism if it ever comes back, essentially. And what we found is that depending upon which organism it is and what part our immune system is targeted, that over time that immunity will wane. In some cases it doesn't wane very much at all. In some cases you have lifelong immunity. But specifically with COVID, we appear to have a waning of immunity that happens, and it varies. For example, Pfizer seems to wane more quickly than others in terms of antibody numbers. And by exposing us once again to the antigen, or that's the protein on the spike protein, which is what Pfizer does when we take the Pfizer vaccine and re-exposes to that protein, we boost our immune response because once again these B cells see these proteins and they go, well, let's make a bunch more antibodies, and they boost up again, and that is protective. We see that with the tetanus vaccine, for example. Every 10 years you need to get a tetanus vaccine. Similar type of thing. Our strength wanes over time, and we see it with chickenpox, the varicella zoster chickenpox vaccine as well. It's a similar type of thing. And what happens if you get low enough immunity, theoretically, you could be a target for infection. So that's what the booster is.
So who is first in line to get a booster shot?
Okay, I just want to point out, we're talking about essentially our third shot. And when we're talking about the third shot, I just want to make it clear that about the same time as the boosters came out, we also came out with the idea that some people need a third shot for if they're severely immune depressed. These are people who have problems with their immune system, and they're actually getting a third shot, and it's not a booster for them. That's considered their series, like yours and my series would be 2 shots, let's say, just like the hepatitis B series is 3 shots. These people who have decreased immune systems, they actually need 3 to be able to mount the same immune response that you and I might mount. So that's a different class. Those are people who are greater than 65 years of age with medical conditions and so forth, and immune conditions. The booster shot, which is for your general public, essentially, to boost our immunity against this. Who is involved with that? Greater than 65, people with underlying medical conditions, people who work in high-risk areas, people who live in high-risk areas. To be perfectly frank with you, it's a very broad category of people who can get it. My sense is that a large portion of the people might end up getting this, and frankly, it's probably going to do most everybody good who gets it. From my understanding, you're self-identifying when you have a condition of concern, and so we're going to see quite a few people getting this, I think.
So since the last time you were on this program, the FDA finally approved the Pfizer vaccine. What is the difference between approval and its former emergency authorization status?
Okay, well, so there's a very strict process to approve a drug by the FDA, and they went through most of that process with what the emergency use authorization, or the EUA, which what it originally had, and they've gone through all that. Now, most of the time they don't give EUAs. Most of the time they wait for approvals before a medication is available to the public. But when they have a significant emergency within the population, if enough people are affected potentially negatively, when they have a drug that by all intents and purposes looks good, they grant EUA. That's the emergency use authorization. Once they have all the data they really want, which usually includes a couple of studies, then they're able to give the full authorization by the FDA.
We are sort of getting into a phase of pandemic fatigue. What is your advice for people just to recharge them about keeping themselves and their families safe?
You're right about the fatigue, and my strongest recommendation is to get vaccinated. I really think that's, and then if you really want to be a survivor, you want to take care of yourself and your family, I say get vaccinated if you possibly can. If you can't get vaccinated, and there's only a few who can't get vaccinated, then we need to make other provisions for you. But the number one thing is for you to get vaccinated because vaccination is highly protective of hospitalization and severe disease, and so that's what I would recommend. Obviously, we want to continue to have we used to talk about something called the Swiss cheese model of protection. And that's basically where not everything is 100% protective, but if you add layers of protection, it's harder for you to get hit. So if you can add a mask, if you can socially distance, you can just stay away from people who have the disease, and you get your vaccine, you're likely not to get the COVID virus.
Well, Dr. Prince, thank you so much for being with us today and keeping us informed from the front lines of this pandemic. We appreciate your time.
Yes, sir. My pleasure. Take care, everybody.
And we'll be right back with more. Stay with us. Let's continue our discussion with our local medical professionals, and joining me is Dr. Christian Zuber, the Orange County EMS Medical Director. Dr. Zuber, thank you for being with us today.
Oh, it's my pleasure to be back. Thank you.
So, Dr. Zuber, are the coronavirus infection numbers starting to go down here in Orange County?
They are. We've seen some pretty good decrease in our numbers from the previous month. So I think it looks like we are turning the corner in the positive direction in terms of numbers dropping.
So how is the hospital patient capacity right now when it comes to the ER and just people normally going to the hospital?
Sure. I think our numbers are coming back to where they were before the most recent surge. I know that in the media we've heard about hospitals on status black, and those are coming back down to their normal pre-surge status. So capacity is there, and I'm confident that our hospitals in the area have the capacity to treat all the patients that present.
So tell us about the increased vaccine efforts here in Orange County.
Sure. We're really pushing the I Got My Shot campaign. We've found that during this most recent wave, peak, if you will, most of the people that were sick or hospitalized were unvaccinated. So I think it's a great time to redouble our efforts down to really addressing vaccine hesitancy, as well as to ensure that there's an ample supply of vaccine available in the community for everyone who wants to be vaccinated.
And are you seeing that vaccine hesitancy increase, or is it pretty much staying the same, or is it the same people? What's really going on with people who don't want to get vaccinated?
Sure. I mean, some people just aren't comfortable with the idea of being vaccinated. I think others were concerned that the vaccines were operating under the emergency use authorization and weren't fully approved by the FDA. And since that, the Pfizer vaccine has become a fully approved vaccine. So I think all of that's helping, but I think what we really are also seeing is people are being exposed to family and friends that came down with COVID this time. We got hit much harder during this last surge, and so I think that's playing a role as well. All we can do is try to educate and give people every opportunity we can to get vaccinated and to answer their questions.
And on the other end of the spectrum, is there still a push for people in Orange County to get tested for coronavirus?
We have seen our testing numbers drop as the peak is dropped off. We still have testing available in Orange County. We're providing that to our citizens. So the opportunity is still there, and I would encourage anyone that has symptoms consistent with it to get tested.
And where are we with the mask recommendations in Orange County?
So we still recommend masks, especially when you're indoors or and you can't social distance. I think there have been breakthrough infections from folks who are vaccinated. Many of them were immunocompromised and with other medical problems, but masking is still a really important component to our strategy to prevent ongoing spread of the virus.
Well, Dr. Zuver, thank you so much for being with us today. We appreciate your time.
It's my pleasure. Thanks for having me.
We'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And of course, we are also here to help you keep making those healthy connections. Stay safe.